Public Health. Our goal today is to give you a COVID-19 update. I'm joined by Dr. Geraldine Luna, Medical Director at the Chicago Department of Public Health, who will be providing some remarks in Spanish after we get through. Perfect. So I want to start, actually, before we get into a COVID-19 update, by sharing something we're really excited about at the Chicago Department of Public Health. We are putting out today a request for proposals for something called the Healthy Chicago Equity Zones. And this is some work that we'll be doing at CDPH that funds regional and community-based organizations across Chicago to work on hyper-local strategies to advance health and racial equity, starting with targeted vaccine outreach. So you can read more about this online, but the whole city of Chicago has been divided into 6 zones. We've used the same zones that are used in the planning department. And the goal here is we're going to put about $9.6 million out initially. This is money from the CDC. We'll be looking to fund a lead organization in each of the 6 zones, who in turn will then work with community-based organizations in every neighborhood in Chicago. And initially, we were really building on some of what we learned from Protect Chicago and Protect Chicago Plus. The communities that had this kind of targeted outreach from community-based organizations had an increase in vaccine coverage of about 300% in just the 6 weeks of running the first part of that program, almost twice what we saw increase across the city. And so our goal is to make sure that over the summer, while we're working to build vaccine confidence and vaccine convenience, the work of trusted community-based organizations and vaccine ambassadors can be sustained. But then post-COVID, we're going to want to work with these groups on other issues like healthcare and social service access, food access, housing conditions, community safety, and the physical and built environments. So this is really just the first down payment. We're hoping this will be a multi-year work with additional funding that will come in. And we really see this as a way to get at a lot of the health inequities that have plagued not just COVID, but the city for a long time. So excited about that. If there are community-based organizations that are interested, please go to the website and apply, and we will share the news when the awardees are selected. Okay, so here's how we're doing with our COVID update. chi.gov/COVID- is how you can always get the most up-to-date information about COVID in Chicago. And what you see broadly is that our case count remains in the high-risk territory, but it is getting better. We're averaging 548 new cases every day here in Chicago. We want that number down under 400 and ideally under 200, but it's down from over 700 just a couple of weeks ago and heading the right direction. Similarly, our COVID test positivity today for the first time is at 4.9%, under 5%, which really is our goal. And that brought us down to lower risk today. That has also decreased nicely from a high of 5.8%. Our hospital beds and our ICU beds remain at moderate risk, and we'll look at the details there. But what you can see is that compared to just a few weeks ago, where most of this was in very high risk territory, partly because of the numbers and partly because of the rate of increase, we're now heading the right direction. And here you can see that our testing volume has remained good. We're doing more than 13,200 tests every day here in Chicago. We've done about 3.9 million COVID tests, and it's not a problem of seeing COVID testing fall off. Here's what our case count looks like. You can see cases are declining nicely after that increase over the last 4 to 5 weeks, and that is exactly what we need to see to be starting to think about and talk about further reopening. If we look at what's driving those case counts, what we see is really across all age groups except those over 80, we are seeing nice declines in cases. People over 80 still have a relatively low rate of COVID, but it is on the increase. So right now, I'm going to just ask everybody, if you know anyone in Chicago who is older, who is over 65 and has not yet gotten a vaccine, please, please, please help them get vaccinated. We'll talk about how to do that in a minute. But besides those over 80, we're seeing declines across all age groups. And interestingly, we're now seeing equal COVID rates for people in their 20s, in their 30s, and in their 40s. So thanks to everybody who's been being careful in those groups, and especially to those who have been being vaccinated. If we look by race ethnicity, so in purple represents Black non-Latinx Chicagoans, in blue Latinx Chicagoans, in red white non-Latinx Chicagoans, and in green Asian non-Latinx Chicagoans. All of this data is publicly available, and we'll post it on the website. You can see that the new COVID case rates still are the highest among Black Chicagoans, and that is most attributable to the fact that we are seeing the lowest vaccine uptake among Black Chicagoans. It's one of the reasons we're really focusing a lot on bringing vaccine to heavily Black communities, working with a lot of community-based organizations and trusted messengers in those communities. But you can see that the rates are coming down just a little bit among that group and broadly more down across the other race ethnicities group. If we look over the last 3 weeks, you can see how quickly COVID has been shifting across Chicago. If we look back to the end of March and early April, that's when our surge was really kicking off. And you see most of those cases were actually on the north side. For the first time in Chicago, we were seeing the largest number of cases represented by the darkest blue on these maps in the Lincoln Park and the Lakeview areas. And then in the middle of April, really more of an expansion, seeing a lot more cases across the south side and really across the whole north side. And then as we've been moving ahead and cases have started to come back down, really seeing most of our cases on the south side with some more still on the northwest side. But I want to highlight, we continue to see COVID cases out of every single zip code and community area in Chicago. So while we're making good progress on vaccine, we are not yet done with COVID. And the number one thing you can do to protect yourself is to get that vaccine. But we still have a ways to go. We still have a very generalized outbreak here in Chicago. If we look at our hospitalization data, you see that we're seeing some flattening in those increases. This is showing what our hospitalizations on the top, non-ICU, and on the bottom, ICU, have looked like throughout the outbreak. And you can see that with this third surge, we did not get anywhere near the levels of hospitalizations that we saw in either the first or the second round. And that is largely because of vaccination. We're averaging now 374 Chicagoans are in the hospital with COVID, not in the ICU. That's up from about 223 in March, but it is stabilizing. And then similarly, we've got about 146 on average Chicagoans in the ICU right now with COVID, up from about 68 if we look back to March, but also stabilizing. And also, if we look at the geography of where this is coming from, the more severe outcomes, really seeing these in our less vaccinated areas in Chicago. So on the left here, this shows you the geography of where folks are living, where we've seen the most hospitalizations from late March through late April. And you can see a lot of concentration on the south side and a little bit on the northwest side. And that there's a lot of match there with areas that are less vaccinated. And then if we look at deaths, also seeing more concentration on the south side as well as some on the northwest side. And I do want to highlight, though, that we have also had a hospitalization out of every area in Chicago just in the last month. So we're still not done with COVID, although we are making amazing progress and are getting close to getting to the other side of this outbreak. Vaccines are how we're going to get out of this here in Chicago. And we are averaging 4 COVID-19 deaths every day in Chicago. That is stable. You can see it's down from an average of about 25 with the second peak and down from about 50 a day in our first peak. We have passed 2 million COVID-19 vaccine doses administered here in the city of Chicago. That's an exciting benchmark to hit. We've passed more than 230 million COVID vaccine doses that have been administered across the United States, and we're making amazing progress here in Chicago. If we look at the coverage, the blue line here represents those who are over 65, the red line are those over 18, and then the black line is all Chicagoans. So at this point, 43% of all Chicagoans have gotten a first dose of vaccine, 54% of Chicagoans who are over 18 have gotten a first dose, and 65% of those over 65 have gotten a first dose. But 65% of those over 65 is not good enough. Chicago is at or ahead of our metrics across the state and across the country for general coverage, for coverage by race ethnicity, but our coverage for those over 65 is still lagging. The country overall, 81% of those over 65 have gotten at least a first dose of vaccine. So we still have a lot of work to do there. And then if we look at the geography of where we are needing to do some more work in terms of getting folks vaccinated, you see these patterns are quite similar to where we're seeing more of the COVID cases and more of the COVID hospitalizations. The areas in lightest blue here are the areas that have the least vaccine coverage. So on the left, this is first dose, and those areas in lightest blue, really on the west side of the city and then broadly on the south side of the city, there only about a quarter to a third of people have gotten that first dose. Whereas in the darkest parts on the map, more than half and sometimes as much as 75% have gotten the first dose. And then on the right is the completed vaccination. So we have a lot of work to do. And as we've moved from Protect Chicago Plus, our focus increasingly is on those less vaccinated areas in Chicago, building vaccine confidence, building vaccine convenience. We continue to meet all of our efficiency goals here in the city of Chicago. Last week, 98% of our allocated doses were distributed. We've met that goal of 95% every single week. I do want to highlight that I think possibly this week that we're in right now may be the first week where demand is dropping a little bit and we're getting a lot of vaccine in to federally qualified health centers and pharmacies directly from the federal government. That this could be the first week where all of our vaccine does not get allocated. But to this point, 98% of it has been distributed, and we're really proud of that. And then similarly, last week, 7 days after delivery, 88% of Chicago's doses had been administered. Meeting our goal of 85%, we still are putting all the vaccine in arms. And really, really pleased to be at a point where finally there is enough vaccine for anyone in Chicago over the age of 16 who wants a vaccine to get one. Let's do an update on our current programs. So all of this information is available on chi.gov/covidvax. But I want to make sure that you are hearing the information about how you can get vaccinated and some of the work that we're doing to try to bring vaccine to people, meeting folks where they are. So first of all, we continue to have a lot of points of dispensing and mass vaccination sites. The ZocDoc.com/vaccine remains your best place online to make an appointment. I was on there earlier. There are at least 10 sites across Chicago that have appointments available today and tomorrow. You don't have to wait. You can make an appointment. You can also call our hotline, 312-746-4835. You don't have to wait for someone to pick up the phone. We've got it staffed with hundreds of people who will help you get an appointment at a time that works for you near your home. Related to our mass vaccination sites, I want to just give a quick update related to drive-through as well as what's happening with Pfizer. We've been working to get online which vaccine is being used at which site. All of the City of Chicago pods have been using Pfizer. We had switched where there had been some Johnson & Johnson with the pause there. And at the moment, they all are continuing to use Pfizer. However, we have now added Johnson & Johnson as drive-through at Chicago State University. So for people who are really interested in getting Johnson & Johnson and interested in getting drive-through, you can get that at Chicago State right away. You can drive down there without an appointment. Even better, call or go online to make an appointment. We also have J&J available at Kennedy King College on Saturdays from 9 to 3. That's especially with a focus for people from Englewood and West Englewood. And then we're doing additional J&J outreach opportunities. The Chicago Federation of Labor, for example, has specifically asked to switch back to Johnson & Johnson. Our Protect Chicago Homebound program tomorrow will be switching back to Johnson & Johnson. And we're excited about having the opportunity to use it in a lot of new settings. And then finally, I want to give an update about the United Center. The United Center has been a hugely successful venture for us, and I really thank the federal government for providing that additional vaccine when we needed it, providing the staffing, providing the support. We are now entering our 8th week of operations at the United Center. This was originally planned to be an 8-week engagement from the federal government. It's been going really well, so this will be our last week for walk-in appointments for the Pfizer vaccine. But then starting next week, we are going to do 1 week of walk-in J&J appointments. So that will be starting on Tuesday, May 4th. We're going to offer, the full complement of J&J appointments appointments, May 4th through May 10th, walk-in for J&J. And then we will not be offering any additional first doses at the United Center. The team will stay to complete all of the second doses of Pfizer on time, no issues there. But we are also going to start the drive-through again at the United Center with J&J. We'll be starting the drive-through on May 8th, that's Saturday. And then even when the walk-in is done and the federal partners go home, at the moment, if we see good uptake, we are planning to continue the United Center only as a drive-in site for Johnson & Johnson, likely going all the way through June, depending a little bit on uptake. So the bottom line is right now, you can get a vaccine at the United Center. It's Pfizer. You can walk up. You can make an appointment. We encourage you to do that. But starting next Tuesday, you'll have the opportunity to walk in with J&J, and then there will be opportunities for drive-through as well for J&J coming there. Our Protect Chicago Homebound program is going very well. We have called every single person who has signed up for the Homebound program on the list. There's been lots of vaccination that is happening, and we have another 1,200 homebound site visits scheduled through mid-May. So if you signed up and you have not heard from us, it's because we left you a voicemail or weren't able to connect. Call the call center again, 312-746-4835. We want to get every homebound senior done by mid-May. Our strike teams continue. We've gone to more than 450 senior facilities in Chicago. We're all the way through the first dose and 94% through the second dose at those sites. We're through all of the shelters, and now we're doing a lot of work with low-income and transitional housing, again, bringing vaccine to where people are. We have ongoing work with the Chicago Federation of Labor, multiple events, a lot with Johnson & Johnson at their request there, a lot of ongoing work with employer engagement, and I'm very happy to say that the vaccination station is coming back online with Johnson & Johnson available. It will be running tomorrow in South Shore, specifically with a big stop at the Atlas Senior Center. It'll be running on Friday in Austin with a big stop at the West Chicago Avenue Library. Again, no appointment needed. The idea here is to bring the party, bring the vaccine, and really have this be a convenient way for people to get vaccinated. This has been very popular. We are working with CTA. We're making more of these buses to become vaccination stations. So you will be seeing more of these buses retrofitted. We don't vaccinate anybody while the bus is moving, but the idea is that you're able to know along routes that buses run, opportunities to get vaccine, and then stops at places where we know people will want it. You're also going to be seeing a lot more vans and tents and working to really bring vaccine to all of the events that make Chicago Chicago in the summer, whether that's some of the festivals or the block parties, a lot of the places where people are gathering. We're doing a lot of planning about making sure vaccine opportunities are available there as well. We're working with the Illinois Restaurant Association. Multiple events over the next week or so that have been set up. There's one in Rogers Park, there's one in Bridgeport, there's one in South Shore, there's one at the Humboldt Park Fieldhouse, really with a focus on restaurant workers. And then we have many, many other initiatives. Faith Month, of course, is wrapping up here in April. We worked with more than 70 congregations, and thanks to all of them, thanks to Walgreens that was the partner there, and there's more information online. And then we're doing a college day this Friday on April 30th. ZocDoc.com/vaccine is where you can sign up, really calling students, alumni, parents. Chicago State University, Wrigley Field, United Center are all open, and there's a lot of work that the colleges are doing to get folks vaccinated. We really want to get, if people don't live in Chicago in particular, get both of those doses in before students head home for the summer. And then looking ahead, Mother's Day is coming up, and there's a lot of creative things happening there. I want to give a shout out. May 6th, the Friday before Mother's Day, the Mariano's in Bronzeville is not only offering vaccine for 200 people, but is offering free flowers for mom if you come and get vaccinated. The Small Bar in Logan Square is doing something May 7th. You'll see more about this, but really thanks to the folks on my team and folks around the city that are thinking about creative ways. And then just to give you a taste of some of what's coming, there's a vaccine ambassador program program that we have launched and will be expanding. City colleges work to create some training, and we have some of our contact tracers that have been transitioning to do more of the vaccine outreach that have done that training, and that vaccine ambassador program is going to be available to other organizations and likely just individual Chicagoans to make sure people can get the training to become vaccine ambassadors. You'll be hearing more about Vax and Relax, which is going to be some work partnering with barbershops, salons, nail salons, thinking about giving people free haircuts and nail treatments and pairing that with vaccination. You'll hear more about Vax Pass, which is going to be some work where if you get a vaccine, you'll be able to get into a concert or get into an event, and really thinking particularly for younger people, how can we make vaccines something that people are excited about getting? And then, as I mentioned, a lot of vaccination planning for summer events. So our goal is to work to bring vaccine to people, build that confidence, and build that convenience. And I just want to end by highlighting again the Chicago Vaccine Hotline, 312-746-4835. Please call. Please have anybody you know who needs vaccine call. We will work to get you set up with a vaccine. The number one way people are still getting vaccinated in this city is through healthcare providers. Your doctor, your pharmacy. We're pushing vaccine out to hospitals, and these are going to be our trusted partners for the long term. ZocDoc.com/vaccine remains your best one-stop shop for being able to access vaccine in Chicago. And when you make an appointment through ZocDoc, if you say you need transportation help, we'll send you an Uber code there and from any City of Chicago site. Those are the ones that say Protect Chicago. Really, if you've got a barrier, give us a call. We want to help get you vaccinated, no matter who you are, no matter where you live in the City of Chicago. Okay, and with that, I will turn it over to Dr. Luna just to do a summary of those remarks, and then we will come back to take your questions.
Thank you, Dr. Arwady. Muy buenos días. Yo soy la doctora Geraldine Luna, directora médica del Departamento de Salud Pública de Chicago. Y hoy les traigo excelentes noticias. Primero que nada, ya alcanzamos 2 millones de personas aquí en Chicago vacunadas. Eso nos llena de emoción y nos abre, ¿verdad?, la plataforma para la siguiente información. Ya estamos prácticamente en primavera, moviéndonos a verano. Qué hermoso día el de hoy. Pues esta semana alcanzamos 14 días de tasas estables y decrecientes en seropositividad en nuestros miembros comunitarios. Estas son excelentes noticias. Los casos bajaron de 5% seropositividad a 4.9%. Y con varios indicadores de salud positivos que nos aseguran que las vacunas están funcionando. Solo tenemos que ir a tomarlas, protegernos y proteger nuestras familias y comunidades. Los casos bajaron a 548. En hospitalizaciones tenemos 374 casos. Es mucho, pero comparado con el principio del reapunte del COVID-19, estamos mejorando. Y los casos en el intensivo son 146. También hemos visto una baja en esos casos. Y las muertes se han mantenido estables. Y creemos firmemente que tiene mucho que ver con que nuestra población de la tercera edad, de 65 años y más, 65% ya se han vacunado, disminuyendo considerablemente las complicaciones y muertes por COVID-19. Pero todavía tenemos mucho camino que caminar. No es momento de bajar la guardia. La vacunación sigue siendo la clave de nuestra lucha contra el COVID-19. Es por eso que le informamos al público, especialmente a la comunidad de habla hispana, que la escasez de vacuna ya no es barrera. Como dijo nuestra comisionada de la salud, las vacunas están más que nuestras demandas, están más altas. Este es el momento de vacunarnos. Chicagoenses de 16 años o más ahora son elegibles para la vacuna del COVID-19 sin necesidad de hacer cita en todos nuestros sitios de clínicas de la ciudad y del Departamento de Salud Pública. No olviden que su estado migratorio no importa, son gratis, son para todos. Y no se requiere un seguro médico. y mucho más a beneficio, ya no requieres comprobante de domicilio. Toda persona que se sentía amenazado por llevar comprobante de domicilio en nuestras comunidades más afectadas, más vulnerables, no es necesario. Puedes llegar a cualquier sitio de nuestra ciudad y va a recibir su vacunación. Le queremos recordar a todos los menores de 18 años que deben estar acompañados de sus padres o un tutor legal. Por favor, para esta información visite al socdoc.com/vaccine o llame al teléfono para su conveniencia al 312-746-4835 y le daremos una lista de sitios disponibles y programas donde puede programar su cita. Las actualizaciones que queremos compartir con ustedes es que acabamos de lanzar unas propuestas para las zonas de equidad de Chicago, para mantener Chicago saludable. Y esta es una iniciativa de la ciudad basada mucho en el renglón de Protege a Chicago Plus. Es un esfuerzo para llevar justicia social a todas nuestras comunidades más altamente afectadas, a todas esas comunidades que necesitan de la inversión del gobierno. Las solicitudes están abiertas para organizaciones regionales y comunitarias para que lideren estrategias hiperlocales para promover la equidad racial y salud, comenzando con el acceso de vacunas específicas en todas las áreas comunitarias de índice de vulnerabilidad alta y media. Las solicitudes de propuestas identificarán a la organización regional para encabezar cada una de nuestras 6 zonas. Estos líderes regionales deberán subcontratar al menos una organización comunitaria para cada vecindario de su región. Las propuestas se requerirán el viernes 28 de mayo del 2021 a las 12 p.m. hora central. Por favor, todas esas personas, todas esas organizaciones invertidas en nuestras comunidades más altamente afectadas y vulnerables, consideren solicitar. Por último, el programa de vacunación residencial para personas confinadas a sus hogares continúa igual que el programa de vacunación móvil. Mañana miércoles, el autobús de vacunación estará en la comunidad de South Shore, en el Atlas Senior Center ubicado en el 1767, al este de la calle 79. Y el viernes en la comunidad de Austin, en la biblioteca de la Avenida de Chicago ubicada en el 4856 al oeste de la Avenida Chicago. Por favor, estas iniciativas son para facilitar y lo hacemos a su conveniencia en el momento que usted lo necesite. El United Center va a cambiar ahora el J&J con los walk-ins, o sea que se pueden acercar inclusive caminando, desde mayo 4 al 10 para primera dosis. Después mayo 8 abre para que puedan entrar con vehículos de motor. Mañana 28 nuestros programas de confinado al hogar por condiciones médicas cambian de vuelta a J&J. Y estamos instando y trabajando con nuestros universitarios, da que los casos positivos están más designados a 18 a 49 años. Queremos instar a todos nuestros universitarios a que se vacunen. El viernes, abril 30, tendremos las actividades, se llama vacunación para colegiales, en el Wrigley Field, Chicago State University y Credit One Arena. Así que todo el mundo, por favor, a vacunarse. Estamos moviéndonos rápidamente para lograr esa vacunación en rebaño que tanto buscamos. Y muchas gracias. Protégese, Chicago.
Thank you, Dr. Luna. Happy to take questions.
Thank you, Dr. Arwady. You did not bring up the new decision by the CDC. What are your thoughts about not wearing masks outside, and does that mean Chicagoans follow through, or is the city going to keep its mask mandate?
The city will follow the CDC. So for people who are fully vaccinated, 2 weeks post a second dose, you no longer need to wear a mask outside unless you're in crowded settings, which is what the CDC recommended. And so if you are out and about, this is just highlighting again that you getting vaccinated is the best thing that you can do to lower your risk. And so we've said all along, when you are fully vaccinated, you don't need to do the testing, you don't need to do the quarantine related to travel. We've said if you're fully vaccinated, you can be meeting in groups indoors without really significant concern. And now we will be following that CDC guidance that if you are fully vaccinated, you don't need to wear a mask outdoors unless you're going to be in crowded settings where it may be harder to keep some distance.
So I assume that you support that decision yourself.
I do support that decision, yes. I was in conversations, as the CDC was thinking about this, and, I think it's a step, right? This is going to be an ongoing transition for us from COVID. And all along, we have felt strongly, and as we were thinking about reopening, that we were much more confident with doing that out of doors, even at the time where we were seeing increasing cases, knowing that the risk is greater indoors. And so I think this is going along with the fact that the risk is lower when people are out of doors broadly. And again, if you are not vaccinated, you need to keep wearing that mask. But if you are fully vaccinated, the risk for you being out of doors, especially unless you're in a big gathering of some kind, is low.
Can just follow up on that. Do you think this is going to have any impact on people's enthusiasm for getting vaccinated when they see, restrictions easing? And how will it impact the vaccinations?
Yeah, I hope so. And I hope people hear that in this federal guidance, as we will be opening things up a little bit more in sort of the days and weeks to come, there's going to be more opportunities for people to do things if they're vaccinated. There will be more ability because honestly, the risk at this point when people are gathering, yes, we still have, almost 550 cases a day. That's a high risk for Chicago, but very different to before a vaccine. The risk at this point is split. If you yourself are vaccinated and you're in a setting where most people are vaccinated, even if there's 550 cases a day in Chicago, your individual risk is low. But when there are 550 cases a day in Chicago and you are not vaccinated, and especially if you're gathering with a lot of other people who are not vaccinated, the risk starts to get more concentrated in those areas, and in fact, it goes up. And so, we will be, I expect, sort of over just the next few days, be turning that dial and be announcing some additional reopening, because you heard we're making some really good progress here. But I want people to hear that within that reopening, we are making the assumption that Chicagoans will continue to make that decision to get vaccinated and recognize that the risk is increasingly going to be on the people who have not yet been vaccinated. And we think it's appropriate to do some reopening. And especially for folks who have made that choice, they're going to be able to get back to the fun with a lot less worry.
Can you talk about the types of things that are actually, that people can look forward to? I mean, how is this going to impact like youth sports where you still see the little kids running around wearing masks? What about parades and concerts and stuff like that?
So youth, are not yet able to get vaccinated, right? If they're under 16. And certainly I'm hopeful that the FDA, Pfizer has submitted its information for the study for 12 to 15-year-olds, and it looked really good. So I'm hopeful that perhaps in May, we may get that approval, the emergency use authorization for kids 12 and older for Pfizer, but we don't know yet. And at this point, children are unable to be vaccinated, and the recommendation for masks would remain in place for them.
What about like teenagers, though? I mean, if they're old enough to get vaccinated, how might this impact those sports? And then if you could also address parades and concerts.
Yeah, so I think children are going to be a little more complicated in general, because even if they're 16 and 17-year-olds, depending on sort of if there's mixed ages on teams, et cetera, and some of this is about, are you gathering in spaces where people can't keep distance? So we'll have some more specifics to say kind of about some of that youth guidance, but this is, it's another space where we're open right now to everybody over 16 and 17 for vaccination, and if we can see a lot of 16 and 17-year-olds vaccinated, it will make us feel more confident about being able to, think about loosening some restrictions there too. I think mostly, though, it's going to be when we can really work on getting adolescents vaccinated broadly that we'll be able to make some changes there.
What about those going to baseball games? Could you increase the amount of people who are in the stands?
Yeah, so all along, our plan absolutely has been that as COVID comes under control here in Chicago and here in Illinois, we will be turning that dial. So yes, I am assuming, and this is, we'll be talking some more details about this to come, and the state has said the same thing, that as long as we can turn that dial and continue to see cases, hospitalizations, stable or declining, I do anticipate that really over, as we're looking ahead over the next few months, as long as our cases keep going down, which really means vaccinations go up, that we would be moving again in a dial way toward more reopening, including in sports stadiums.
Any impact on outdoor dining? If people are going to be outdoor dining, do they even need to bring a mask with them to go in?
Are they fully vaccinated?
Yes.
So, for people who are fully vaccinated, remember, and we'll share some more details about this, masks remain required indoors, just to be very, very clear about this difference. We are very, very strongly still requiring. The risk remains higher indoors. We know there's the possibility for people who are unvaccinated not. If you are meeting in your home, right, with a group of people who are fully vaccinated, you do not need to be wearing masks. That has actually been our guidance all along. But if you are out in a restaurant and you can't know whether everybody around you has been vaccinated, we're working to get restaurant staff vaccinated, et cetera. The expectation remains indoors that you would be wearing that mask, putting it on when servers are near you, et cetera. But fully vaccinated, out of doors, we're mostly thinking about when people are out and about, and we'll share some more details as it relates to some of the dining recommendations in days to come.
Can I ask you about the $10 million? Is the $10 million coming from the city budget allocations or from federal stimulus?
It's coming from federal, it's coming from the CDC. So the Centers for Disease Control is the major funder for the Chicago Department of Public Health. And we've been very, very pleased that the CDC has signaled interest in taking, not only supporting a lot of the vaccine work and public health work, but really thinking about how can we build on this work to do more of the health equity work long term. So the initial allocation, the 9.6, nearly $10 million, does have this initial vaccine focus, but we anticipate continuing to use federal money from the CDC to fund this in years to come. Of course, we'll have to see what comes, but that's what we're expecting, and we're really excited about that being central to our commitment.
And just a follow-up to that, didn't the city already put out a $10 million RFP for vaccination equity zones? Is this different than that?
So this is our first full city RFP that has this focus on these healthy Chicago equity zones. We have certainly done quite a bit of funding for organizations for a whole range of work. We had we funded some community-based organizations, particularly for Protect Chicago Plus, but this is the major RFP that's starting our long-term work. So,
if you were an organizer for the 4th of July, would you say, let's have a parade and a party and some fireworks?
If I was an organizer for the 4th of July, I would say, first of all, let's do everything we possibly can to get the people who might want to come to whatever event I'm hosting vaccinated. I do think, and we've been saying this all along, that by this summer, we're expecting to be in a much better place, certainly than we were last year. I expect that we will have some version of these activities that we love. I can't promise standing here right now, when we're not even half vaccinated as a city yet, that we'll be able to say sort of we're done and we're fully open. But I hope people are hearing that with each of these steps, and you're going to hear some more, in days to come here, we're feeling confident about the way that we're going. But that is fully contingent on people continuing to make that decision to get vaccinated.
Very good.
Anything else that you can tell us about this Vax Pass you're talking about, and how is this going? How would this work?
Yeah, so we'll be sharing some more. We're anticipating this will be sort of a May type, starting in May, and some details to come. But just to give you a sense of what we're thinking. So certainly, as we build vaccine confidence and convenience, we're interested in thinking about ways to incentivize people to get the vaccine. I would hope that for most people, their main incentive is to be able to stay healthy, keep their families healthy, keep their communities everybody's healthy, but we also know younger people in particular may be excited about the idea of getting into events, for example, that might be limited to people who are vaccinated. So we're exploring some possibilities of concerts or events that might not be just youth focused, but a lot of this would probably have a youth flavor to it. We're working with some club organizers and others, and there will be more information coming. I want to make sure people are hearing that there will be eligibility for this, even if you already got vaccinated. So you don't need to wait to say, maybe I'm going to have the chance for a concert pass or something I really want to do. We'll make sure that that opportunity is available to people regardless of whether they're vaccinated. So I don't want to kind of steal the thunder for the whole thing, but just highlighting this is some of what's coming down in May. And the Vax and Relax also we're really excited about, right? This working with the barber shops and the beauty salons and the nail salons. Again, it's like the main incentive I would hope is to get a vaccine. But if I have the opportunity to get a free haircut or get my nails done in this sort of more of a, like, let's celebrate the fact that this is how we are going to get past COVID. We're excited about it. We're also thinking about where do people stand in lines. You stand in lines at the DMV. You go to the grocery store frequently. Where are places you're waiting? You might wait at a laundromat. Like this idea of, we know from surveying, there are a lot of Chicagoans who, it's not that they've said, I don't want to get a vaccine. It's just maybe not first on their list of things to do. And so thinking of creative ways to get the vaccine available where people are anyway is really going to be central to some of our strategy.
So you're going to bribe Chicagoans to get vaccinated?
We're not going to bribe Chicagoans to get vaccinated, but we are going to do everything we can to build the confidence, to build the convenience, and then to make this fun, to make this something that is, not just sort of a civic duty, but something that I think comes with, I feel very happy about the fact that our case numbers are finally on the way down, and I'm hopeful that they can keep going that way. I'm feeling so excited about the fact that we're thinking in a COVID recovery kind of way. Like, we're really planning in very big ways for like what this is going to look like past COVID. We all want to put this behind us, and getting people vaccinated is the way to do this. So I don't think of it as a bribe. I think of it as a way to celebrate people's vaccination choice.
It sounds like Lollapalooza might happen.
So I'm not going to comment yet on the details of things that would be thought of for late summer. I think we are certainly, again, let me just say this, thinking a lot about people who are fully vaccinated and the opportunities for them to be able to do certain things, but I can't comment on that specifically.
So they're going to need some kind of ID that shows, how are you going to prove it?
So you might have seen, for example, that the European Union said they're expecting Americans to be able to travel to Europe this summer if they are fully vaccinated. There will be more and more of this going on. Right now, I know a lot of people have their vaccine card, and that's good. Hold on to your card. But when you do get vaccinated, your information is in the central registry. It's kept very secure. It's only used for public health. But there will be ways that you'll be able to sort of securely link to that and be able to show your vaccination status, because I think increasingly, and I've said this, let me just straight up say this, we are never going to require vaccination for all Chicago residents. That will never be a requirement. But I think increasingly, where people are wanting to do things and lower their risk, vaccination is going to be your ticket to doing some of that, and you'll be hearing more about that.
Can I just clarify that? Because as I'm hearing you, it sounds like there may be events that are going to be authorized, but the only people who can attend will be those who are vaccinated. Is that what you're saying, or can you clarify?
Yeah, so this Vax Pass idea that I'm thinking about is a little bit along those lines. Those might be smaller events, but there are opportunities exactly for this. That there's something that I might want to do that is valuable to me, and really celebrating again that when people are fully vaccinated, we can gather and we can do these fun things that people love to do. I think there's a big national conversation, as you know, about vaccination proof and vaccination travel. My goal at this point is to say, you want to be part of the fun, get vaccinated. You want to, people have various reasons for why they make this decision. For me, I care the most about my health, my family's health, and Chicago's health. But I know that there are people who may say, I don't feel like I'm at high risk for COVID, but I want to be able to travel again. I don't think I'm high risk for COVID, but I want to be able to go to concerts without worry. That is an equally valid reason for me to get vaccinated. And all of these, now that we have enough vaccine, are the range of ways in which I hope Chicagoans will really make that decision. Thank you.
Thank you very much.